cracks and holes in your teeth need to be repaired. Teeth cannot be open to the oral environment and be safe because bacteria can enter into the harder component is on the outside, the M&M with the harder enamel shell, and then the soft chocolate on the inside is the dentin, is what it's called, and it's a more damageable component of your teeth that bacteria can eat, just like they're eating a tub of ice cream. We don't want that, and so cracks, stuff like that are open to the tooth structure or the dentin need to be repaired. If there are cracks in the enamel, that's us just getting old, just like when we've been down and our knees crack. That kind of stuff is okay if you can bear with it aesthetically. Now, some people move towards veneers, but I gotta say I'm a holistic dentist and less is more. And conservativeness is very important. I don't feel like I'm going to get, a surgery on my arm just to look a lot better on my elbow. And so I can make your teeth a lot prettier without tearing down your teeth to put a veneer on. A veneer is what we call a jacket that it covers the tooth almost like a crown. Now, we talked about crowns in another question, and we said you only do a crown when 2/3 of your tooth is damaged. If your tooth is healthy and there's nothing wrong with it except for the color of it, or except for you see a little crack right here, I can get rid of that without having to do a hat or a jacket over your tooth. I can bleach it out. I can use this component called infiltration, which is where we put white colored filling material in the dental tubules or holes of your teeth to prevent different colors. I had a patient named Karen, and she came in and she had a dark black spot right there on her tooth. I think it just didn't develop right. And somehow when she was a child, it didn't mineralize right. And we did that infiltration and totally dissolved that dark color on her tooth, and she's going around smiling now, and we didn't do a veneer to cover the tooth. So I think people who get veneers are those that can't wait for more conservative methods. I had to do Karen 3 or 4 times to get that result. So she did have to come in 3 or 4 times. A veneer can be done in 45 minutes, and then you have a covering on your tooth that looks beautiful. I think a lot of movie stars lean towards veneers because sometimes they have crooked teeth. But again, I'm a holistic dentist, and I think it's more conservative to move your teeth via Invisalign or an aligner tray that would move your teeth, that they're not so crooked, but you'd have to wait 3 or 4 months instead of maybe 45 minutes to get your teeth a little bit healthier, and get the same aesthetic result, but not tear down the strong structure of enamel that's on the outside of the tooth.